Welcome back. It is 6:17. February 16th. That's a very important day for a lot of people. We now know that is when students in Toronto, Peel and York region will be returning to school after a month of remote learning. And the province says their decision has the support of each region's medical officer of health. So let's get right to the source. Dr. Lawrence Lowe, medical officer of health for Peel region, joining me now this morning. Good morning to you, Dr. Lowe.
Good morning, Melanie.
I'm interested to hear about those conversations and the consultations that you had with the government to make that decision that Peel region just wasn't ready yet. What was the threshold for you?
Well, so in general, we've been looking at the trends, and we have been seeing that we're starting to have trends go in the right direction. However, it's still a little bit early, and we do want our hospital picture to stabilize a little bit more, as well as our testing and tracing indicators to make sure that those are all in the green before we go back to school fully.
Dr. Lowe, when you do go back, when the students do go back on the 16th, is there a plan in place when it comes to the asymptomatic testing, the ventilation? Is that already laid out, the framework for the next week and a half before the kids actually go back into the classroom?
Absolutely. We've been working very closely with our local school boards to maintain our single symptom screening as a more stringent measure for entry into the school for both staff and students. And we're also looking to expand the asymptomatic testing pilot that was done in the region of Peel, among other regions, to include other schools that may be an outbreak in higher risk neighborhoods. So I think there's a number of other measures, of course, that are all in place, but we know that it's really important for kids to be back in school just from a cost-benefit perspective in terms of their socialization, their development, and of course their learning in person.
I want to get to the South African variant, because there's a lot of conversation about that, just knowing that there was one case, but you've said with this one case, not connected to travel that you can see with contact tracing, it is assumed then that it is within the community in Peel region. Can you expand on that?
Yeah, so indeed, the case of the variant B1351, which was initially found in South Africa, certainly raises the possibility that if we open too quickly, there may be a quick erasure of all the gains that we've had there, which is why I think I'm certainly supporting schools as the most important thing in terms of keeping our children's mental health and well-being at the forefront. But there's a recognition that for everything else, the other restrictions, we need to really be careful and cautious as we move towards reopening. Really need to take this gradually, because it really is becoming a race between the vaccines and the variants at this point in time.
And it is a matter of getting those vaccines, literally, physically getting those vaccines so that they can get into the arms of people who need it. I want to get an update as well on the Canada Post outbreak, the facility in Mississauga. Do you have an update on numbers and how the mass testing is going?
Yeah, I think the most important thing about that outbreak is that we've worked very closely with Canada Post. Mass testing has been completed, and many of the staff are currently being isolated in accordance with our directives and protocols. So hopefully we'll see the end of that outbreak in the time being. It's still not quite clear why there was such a rapid increase in cases, but we are waiting for further confirmation from the laboratory, and we have requested variant testing in that instance just to make sure that wasn't the culprit.
Okay. Dr. Lowe, we have run out of time here, but I appreciate you taking the time for us so early. Thank you.
Thanks for having me.
All right, it is 6:21. You're watching BT. Coming up next, it has become a hot button issue. We're talking about vaccine passports that prove whether or not someone has been inoculated against COVID-19. One country is going forward with launching them. We'll tell you where in the world that is, and that is next.